Welcome back, guys. Welcome to MediBlog. Today we are going to continue with the previous video that I have uploaded. So you can see here it's a spotter for microbiology. So you can see here that it is a what is this? Any tube? It's a test. Given is a viral test performed using patient serum. Okay. So the questions asked are: what type of serological test is this? It is a tube agglutination reaction. Okay, tube agglutination reaction. For which disease this test is used? Tube agglutination reaction. This is used for enteric fever. Okay, then viral test. Then what are the antigens used? The antigens used are O and H antigens of Salmonella typhi, H antigen of Salmonella paratyphi A and B. And name the significant titer for each antibody. For O, it is more than 100, and for H, it is more than 200 titer. As you can see here, tuberculosis test, direct fever in second week. Antigen used is O and H, and the significant titer is O antigen. For O antigen, it is more than 100, and H antigen more than 200. So the next it is given. What is this? This VDRL 6-month cavity slide. You can see here this is VDRL done for then identify the spotter. This VDRL. Then the one advantage and disadvantage. So the advantage, it can be used to obtain monitor the response of a treatment, of the response to the treatment. Then disadvantage is that it is non-specific test which gives biological false positive reaction. Okay, can be used to monitoring response to the treatment. Non-specific test which gives biological false positive reaction. So these are some vaccines. So the things that we have to study are what is the type of this vaccine, what type of vaccine is this, mention the route of administration, and briefly explain the immunization schedule. For each of these vaccines we have to study. So another type of question, these all are the types of questions that may be asked. When will you give the vaccine? What type of vaccine is this? Mention the route of administration. So let's look at each of them. First, you can see it is hepatitis B vaccine. Hepatitis B vaccine. So the hepatitis B vaccine, it is a recombinant subunit vaccine, hepatitis B vaccine. And for adult, the dose is 0, 1 and 6 months. That is first taken at 0, then after 1 month, and then after 6 months. It is given as IM at deltoid. In neonates, it is about, the dose is 6, 10 and 14th week. Okay, 6th week, 10th week and 14th week. Then the next one is hepatitis A virus. Hepatitis A, sorry, not virus, hepatitis A vaccine. So it is an inactivated vaccine with formaldehyde. The doses for is, the first dose is given at 12 months, that is 1 year, and the second dose is given after 6 to 12 months after taking the first dose. So the route of administration is intramuscular, given at deltoid. Then third one is MMR. So MMR is a live attenuated vaccine. Then it is given as subcutaneous injection. Now the schedule is 12 to 15 months first dose, and next dose is 4 to 6 years. And the BCG. Next one is BCG, as you can see here. BCG is intradermal, given as intradermal. It is a live attenuated vaccine. Then the schedule is after birth, that is within 1 year. Within 1 year it is given after birth. The next one is DPT, diphtheria, pertussis, tetanotoxin. So it is a live attenuated vaccine. It is given as IM, that is intramuscular injection. The schedule is 6, 10 and 14 week. After that 16 to 14 month, and then after 5 years. Okay, 6, 10, 14 week, 16 to 14 months, 16 to 24 months, not 14, 16 to 24 months, then after 5 years. So the next one is HIV vaccine. HIV vaccine, that is a conjugated vaccine. It is given as intramuscular. The dose is 6, 10, 14th week. Okay, 6, 10th, 14th week. Then the next one is oral polio vaccine. Oral polio vaccine, as it is a live vaccine. It is given, route is given as oral, and the dose is about 0, 6, 10, 14 week and 16 to 24 month. Okay, 0, 6, 10, 14 week and 16 to 24 month. So the next slide is, these are questions related to vaccine. So the next slide is pneumococcal conjugate vaccine is displayed. So I mentioned two indications for this, for the use. It is used in immunocompetent persons, patients like chronic alcoholism and smoking, immunocompromised ones like HIV, etc. So what is the immunization scheme? The immunization scheme for in infants are, it is given in 4 doses. So it is given at 2 months, 4 months, 6 months and 12 to 15 months. Okay, 4 doses. So given as 4 doses. So the next we are going to discuss about another vaccine, that is varicella. Varicella vaccine is displayed. What type of vaccine is this? It is a live attenuated vaccine. So what is the immunization schedule in children and adult? In children, it is given as 12 to 15 months and 4 to 6 years. Booster dose is given at 4 to 6 years. The first dose is given as 12 to 15 months. So the next dose thing. Next we will be uploading in the next quarter, because otherwise the length of this will be very large, very long video will be there. So the next day I will be discussing another video. Thank you. If you like the video, please send it to friends.